But from a psychological point of view, what we talk about is a somatic concept. So mind body को यूटिलाइज करके आप क्या क्या स्ट्रैटेजीज अप्लाई कर सकते हो विच वुड हेल्प यू विथ मेंटेनिंग योर मेंटल हेल्थ एंड फिजिकल हेल्थ एट द सेम टाइम. Before that, just two things. Are there times when you feel your heart rate is too high, or do you feel there is tension on your neck and shoulders? Do you feel कि कोई internal चीज है जो आपको bother कर रही है? Are there certain aspects of your mental health or your thought processes which is bothering you? Because end of the day, a lot of cortisol is released. Cortisol is also adding on to the weight gain aspects. Cortisol तब रिलीज होता है जब हम बहुत chronic stress से गुजर रहे होते हैं. Adrenal gland के थ्रू cortisol रिलीज होता है. Along with that, काफी सारे neurochemicals रिलीज होते हैं. And those can contribute to your weight because your body is going through stress. So एक quick check, हम usually body scan बोलते हैं. Body scan का purpose है, let's do a quick body check. So again, body scan मैंने यहाँ पे अलग से add नहीं करा है, but body scan का concept how to apply. बस आप जब जहाँ बैठे हैं on a long, let's say बहुत time से बैठे हो, just close your eyes and think from the head to toe. What am I feeling in my head? Is there any headache? Do I feel any pressure on my head? क्या मेरे shoulders में कोई tension है? क्या my chest feels heavy? Do I feel any weird sensation in my arms, in my hands? And then you basically progress down from your stomach to your legs to your feet. The idea is simple. Usually the body tension and everything will add on to your stress. And ultimately stress always adds on to the weight. Apart from your lifestyle habits. Now you've done a quick body check. Now what do you do? ठीक है, sensations feel हो रही हैं और बहुत अच्छा भी नहीं लग रहा है. इसके बाद क्या किया जाए? इसके बाद very simple. What you will do is जहाँ पे टेंशन फील हो रही है उस बॉडी पार्ट से एकदम टाइट करेंगे, ब्रीथ इन करेंगे एंड देन वंस यू रिलैक्स यू विल ब्रीथ आउट. जैसे मैंने अगर अपना मुझे हाथ में टेंशन फील हो रहा है, व्हाट आई विल डू इज आई विल मेक अ टाइट फिस्ट. फिस्ट मतलब बहुत तेज मुट्ठी बनाएंगे हम, सांस अंदर लेंगे, विल होल्ड इट फॉर अ व्हाइल एंड यू विल ब्रीथ आउट एंड आप हैंड्स को नॉर्मल पोजीशन पे रिलीज करेंगे. एंड देन यू विल सी देयर इज रिलीव ऑफ टेंशन फ्रॉम द बॉडी. सिमिलरली with your neck and shoulders, what you can do is stretch and your neck and shoulders or move them up. जब आप ऊपर, when you move it upward, you feel a slight tension. Muscle pull जैसा feel होता है, muscle pull exactly नहीं, but muscle tension feel होती है. Hold it for a while. Muscle tension feel होगा. धीरे धीरे सांस बाहर and you slowly relax. So इसको Jacobson's progressive muscle relaxation की strategy बोलते हैं. But इसको we've just modified in a way that what you will do is एक body part पे focus करें. JPMR जो how it works है, तो पूरा feet, arms, legs सब पे focus करता है. But right now, when I know कि अभी मेरे पास पूरा ये muscle stretch and relax का time नहीं है, I will focus more on that specific body part जहाँ मुझे tension feel हो रही है, या weight feel हो रहा है, या एक sensation feel हो रही. Moving on to how does movement help? I mean, ये slide self-explanatory है, तो बहुत detail में नहीं जाएंगे. It definitely lowers risk of neuropathy, aerobic capacity, as in your lung capacity gets better, your insulin and everything levels are come back to normal. Your blood pressure comes back to normal. You build up your muscle strength. You build up your bone strength even. So all of those with simple movements. Movements and exercise are not to be confused. We are not talking about heavy exercise, but some form of movement is always helpful. Okay. So, Jacobson progressive muscle relaxation. Post that, there is something called as the somatic therapy. Now, somatic therapy, somatic का concept ही यही है कि mind body कैसे connect करता है. Now, with this, we have come up with a 6-step somatic exercise. 6-step somatic exercise क्यों? अगर बहुत overwhelmed feel हो रहा है, pre-op, post-op maintenance, all of these things. So the somatic exercise can be very helpful. 6 steps here. I think I'm going to explain each of the steps. Concept simple here. To induce relaxation from the body to the mind, and ultimately the whole body system sort of relaxes. The first step that we do is simple breathing. You will sit at a place, or if you want, you can lie down. Just do a simple inhale and exhale. The only aspect here is inhale from your nose, exhale from your mouth. That's the only switch that we want. Usually हम nasal breathing ही करते हैं, but for the purpose of this exercise, what we follow through is you breathe in with your nose and you breathe out with your mouth. And once you're breathing in and breathing out, what do you feel in your body, in and around body? आपको अपना breath का speed भी पता चलेगा. Am I breathing too quickly? Then I'll try and consciously pause or slow down my breathing. What does my body temperature feel like? How does my heart rate change? Usually जब आप breathing exercise शुरू करेंगे, आपका heart rate पहले थोड़ा सा fast होगा, and then gradually it will slow down. Slow down in the sense it will come back to a normal pace. Now think back to a recent moment where you felt most calm. Calm as in कौन सा ऐसा moment था जब मैं खुश थी चलो, या जब मुझे एक a sense of peace feel हुआ. And all this while you're still breathing in and breathing out. Because that happy memory or that peaceful memory will again induce calm and relaxation through your body. Then gradually you try and work on identifying कि ऐसा कौन सा टाइम था जहाँ पे आपको अपनी बॉडी में डिस्ट्रेस फील होने लगा. What part of your body and what time during the episode you felt a sense of distress? Okay, so again, this is where you experience change in your heartbeat, in your breathing rate, because मैं distress का source identify करने की कोशिश कर रही हूँ. Again, why are we doing this? See, in journey of weight management, बहुत सारे triggers होते हैं, and usually वो triggers जो होते हैं ना काफी distressful होते हैं. उस डिस्ट्रेस को मैनेज करने के लिए सोमैटिक एक्सरसाइजेस मच मोर हेल्पफुल देन योर यूजुअल वंस. नाउ आई विल रिप्ले द सिनेरियो. जब मेरा बॉडी काम स्टेट ऑफ माइंड से स्ट्रेस स्टेट ऑफ माइंड पे गई, एज इफ यू आर वाचिंग अ मूवी की तरह, लाइक 1 episode to a second. क्या क्या चीजें थी. नाउ दिस कुड बी एज सिंपल एज दैट बिंज ईटिंग करी थी जिस वजह से मुझे परेशानी हुई थी, या कोई वेट का ट्रिगर है, या कोई इलनेस रिलेटेड वेट गेन है, या इवन पहले सर्जरी को लेके हेजिटेशन थी एंड उस समय क्या फियर था, पोस्ट दैट सर्जरी हाउ डिड यू फील एंड द चेंज दैट यू आर एक्सपीरियंसिंग इन द बॉडी. And then you gradually again focus on the body parts. So मेरी बॉडी में अब क्या सेंसेशन है. right? So now I want to recall that moment. I will recall the calm moment again. And what are the shifts that I feel in the body? If there is a tensing sensation, tense as in tension build up होना, stiffness feel होना, body temperature में कोई change आ रहा है, chest में कोई sensation feel हो रही है. And then we do a healing hand exercise. तो place your hand in that area जहाँ पे आपको shift feel हुआ. जैसे अगर मुझे shoulder पे weird feel हो रहा है, या एक टेंशन पे फील हो रही है, या आई नो माई स्टमक फील्स वियर्ड, मुझे भूख नहीं लगी है, क्रेविंग हो रही है एंड मुझे बिंज ईटिंग वाला टेंडेंसी है, आई पुट माई हैंड्स ऑन माई स्टमक, वो सिंपल ब्रीदिंग एक्सरसाइज, सेंसेशन पे हम फोकस करेंगे. आई विल कॉन्शियसली बिकम अवेयर ऑफ व्हाट माई बॉडी इज फीलिंग, दैट यू नो व्हाट, आई एम नॉट हंग्री. Mindfulness is what the principle is here. Mindfully, I'll acknowledge the feeling that stomach hungry नहीं है, mental hunger है. Mental hunger को food नहीं चाहिए होता है. So that's why your cravings come out. Or at least वो धीरे धीरे delay होता है. And then you gradually release the tension. Okay, so that is very important. So this 6-step exercise थोड़ा सा elaborated होता है, time taking होता है, however very helpful. Now moving on, what we talk about are the brain chemicals. So all your brain chemicals impact your weight. So dopamine, oxytocin, serotonin, endorphin. So this is like the dose hormone, the dose chemicals. So DOST. इनको increase करने से happiness level improves होती है. Now, if you see a very common aspect in all of these things, meditation हो गया, exercise हो गया, walks हो गया, any form of movement will tend to increase the levels of these neurochemicals. बिकॉज ये न्यूरोकेमिकल्स में जब अप एंड डाउन होता है, आपका मूड लो हो जाता है, एंड लो मूड विल एक्चुअली ट्रिगर अ बिंज ईटिंग पैटर्न और अनहेल्दी resorting to unhealthy habits, maybe drinking, maybe smoking, so any substance related issues. So this is where we talk about working on the dose chemicals. So if you can see, or dopamine, what we talk about is meditation. You will have task completions, setting long-term goals. Exercise regularly is always helpful. For oxytocin, so this is where your acupressure comes in. अच्छा, acupressure की जब हम बात करते हैं, very simple cupping exercise होती है. Not sure if turn on the camera. So what you have to basically do is you use your hands, you bend them a little, and you gradually press each body part. Okay? With adequate pressure, मैं वो pressure नहीं दे रही. Okay, so with each body part, you do a whole pressure release. Okay, all this while you're also doing a breathe in and breathe out. So if I'm यहाँ पे, so this is what you would call as a cupping strategy or a self-massage. Is exactly self-massage because उतना pressure नहीं दे रहे हैं. But to release that stress, this is what we're doing. This is a very helpful exercise, usually part of EFT, so body related, again, even part of your somatic psychotherapy. That helps in increasing your oxytocin level. Serotonin, again, serotonin का huge role होता है depression में. Serotonin level drop होता है, depression बढ़ जाता है. So cold showers, exposure to sunlight, getting massage, getting exercise is again what your serotonin works on. अच्छा, endorphins. Usually, अगर if you would have gone to early morning clubs and everything, you would see सब जगह laughter therapy चल रहा होता है. So this increases your endorphins. endorphins are essentially your happy chemicals. So, exercise ke baad bhi, a lot of you must have heard that happy chemicals are released or de-stressing chemicals are released, and all of those layman terms. What we are essentially talking about is endorphins. So this is where we need to focus on those chemicals. Okay, I hope thoda clear hai. I know new concepts, but very helpful. Thank you.
Thank you so much. It was quite clear. I guess, Arya, if you have any doubts, you can ask. Any team member can also incorporate in between if they want to know something.
I think मैम का लेक्चर अभी खत्म नहीं हुआ है. She is still.
I know. So I just have this one more strategy. I know because time limitation है तो मैंने बहुत excessively डाला नहीं. So this is what we call as shaking out tension. So this, what I'll do is instead of talking theoretically, I'm going to share a simple video as to how to actually go about it. 1 minute ही है, उससे ज़्यादा time नहीं लूँगी. ठीक है? So I'm going to stop sharing the slides and I'm going to share the YouTube screen.
This video will cover a Qigong shaking exercise that helps to relieve stress and boost energy. Starting from a standing position, just begin to gently bounce on the heels. So you'll start to feel a vibration from the feet all the way up to the shoulders, neck, and head. Go ahead and start shaking the hands. And really, it's this idea of letting go. You can shake vigorously if you'd like, breathing in through the nose, out through the mouth, ha sound. And then you can twist, kick out the legs, shake, jump around, really make it your own. So really emphasizing this feeling of being loose and releasing any kind of stagnant energy. So this is great at relieving any kind of emotional tension. Continue breathing, continue letting go, shaking. And then when you're ready, coming to a pause, just standing still, noticing the shifts in the energy. Practice shaking throughout the day, even for just a minute. It will make a huge impact in your peace of mind and clarity. Drop a comment below and let me know how this went for you.
All right, so this was it from my side. Although there is a lot to cover, but keeping the time limit in mind, this is what I'm focusing on. I hope jitna bhi tha will be helpful for you.
Yes.